If someone comes in with diarrhea, you want to establish whether it's infective or not. The reason why that's important is because the treatment is slightly different. Well, it's actually very different. One can be with antibiotics, for example, if the diarrhea is caused by something like C. diff, and another could be by just supportive management, just telling the person to stay hydrated, and perhaps maybe if they feel nauseous, you can give some antiemetics. But essentially, the reason why it's important to establish is because you don't want to miss something that's infective that requires antibiotics to treat it. One of the registrars the other day told me that, yeah, fair enough, diarrhea is an unpleasant feeling, but and having to go to the toilet a lot is unpleasant. But at the same time, if you think about it, diarrhea is a mechanism of your body expelling something that's in the gut. So if we stop this process, then we don't allow that natural process that the body does to expel this organism to happen, or microorganism to happen. So you have to find out whether it's infective or not, because if you now have C. diff and you give someone loperamide, for example, or something that stops them from having diarrhea, then we haven't actually treated the underlying cause. So what we need to ask in a diarrhea history is how long they've been having the diarrhea for, and whether they can pinpoint what could have caused the diarrhea, whether they had a new takeout, or maybe they had food that was a bit off. And it's also important to ask about if they have any sick contacts. So let's say it was food. Did somebody else eat the same food, and how are they? Are they okay? Are they not? There was someone that recently came in with gastroenteritis, likely due to food poisoning. And what happened was that they had made the food on one day. The boyfriend had also eaten that same food. But another thing that's important to ask is when the other people ate the food. And this is something that I kind of thought of the other day, because in this situation, the food was cooked on one day. The next day, the boyfriend ate the food. Then the day after that day that the boyfriend ate the food is when the patient that came in with the diarrhea ate the food. So basically, the boyfriend and the patient didn't have the food at the same time. And that's important to note, because then we can't now say that, oh, it's definitely not food poisoning because somebody else had the food and we're fine. It's possibly still food poisoning because they didn't eat it at the same time, if that makes sense. So that's another thing to remember to ask. If somebody else did eat it, when did they eat it? And also want to establish the colour of the diarrhea. Is it just brown and very loose, or is it actually watery, and does it have a very foul smell? And yeah, just establish the general colour, if it's pale, or stuff like that, because that can help us point towards whether it's something like C. diff or other things that's causing the diarrhea. And if it's C. diff, then we use oral antibiotics, but as opposed to IV. We can use IV as like second line, but oral is first line, because if you think about it, when you swallow stuff through your mouth, that is part of the GI tract. So the antibiotic goes through the GI tract, and obviously the infection is in the GI tract. So oral is the best way of tackling something that's in the GI tract. That's why the first line is oral. Yeah, there are other things that can cause food poisoning, and you can decide whether you can use some sort of antibiotic or not. But a lot of the time, generally, it is supportive management. But like I said, yes, it's important to establish the timeline of the diarrhea, the nature of the diarrhea, the colour and stuff like that, and also any associated symptoms, whether they've been vomiting as well, whether they have any tummy pain, and also loads of different things can cause diarrhea. If diarrhea can even be a reaction to, can even be part of an allergic reaction, like if you've digested something that you could be allergic to. One way in which it can manifest is by diarrhea. Another thing that's very important when it comes to, for example, inflammatory bowel disease, to ask whether there was blood or not in it, and also any other symptoms like mouth ulcers or any rashes or skin lesions, stuff like that, so that you can rule in and out the different causes of diarrhea.